Well, there are some interesting figures we can look at if you like.
Yeah,
if we perhaps can show that slide that we were looking at, and perhaps just pop it up and as we're talking about it. Patients have changed, and certainly that was the old 1970s thing we were talking about. Your viewers will have seen that. It's a hinge knee. If it bent to 90, we were grateful. If the patients went upstairs, we were pleased. And if they didn't have pain, we said, well, you're very lucky. Okay. And so we wanted to change, and this is the driver between, or rather behind, what we're doing. Okay. And your viewers will have seen these patients. They're younger, they're certainly a lot better educated, and they have much higher expectations. And you were talking about running. And now some of the data we've got now, particularly for partial knees, means you can actually run on your knees. So the last London Marathon, I had 2 patients send me pictures of them crossing the finishing line with their partial knees.
And will that have any long-term effect on the wear and tear? Or?
We've looked at ours that are now 10 years old, that were 10 years, done 10 years ago, and we're not seeing increased wear. And so right now we're saying that running is probably okay. So that's interesting. That may not be true for total knees. Partial knees still have the cruciates. There's still a partial resurfacing. But people are going back to golf, skiing, horse riding, dancing, and running. So in many ways, their expectations are higher. And frankly, we didn't realize they were running. We told them not to run, and they were running anyway. And so that's why we looked at those guys, because they've been doing it for 10 years.